Hello everyone. I take great pleasure in introducing myself and my hospital. I'm Dr. Vipul Sud, Senior Consultant in Plastic Surgery and heading the department for the last so many years. Our Department of Plastic Surgery consists of three consultants. Plastic surgery has been part of Batra Hospital right from its inception, that is from 1987. And since then, we have been doing independently and assisting other departments in giving good results for the ultimate outcomes for patients. When you talk about plastic surgery, it doesn't mean that we apply plastic to any patient, but it means to mold and reconstruct. So one has to understand that plastic is mainly reconstructive surgery. That is, try and create something which unfortunately has been lost, either because of any trauma or accident or because of surgery, mostly because of oncological or that is known as cancer surgery. So we play a great role in reconstructing various parts of tissues. We also work towards improving the appearances of people, which God sometimes has been unkind, has not provided you with good looks. We try and create that so that you feel a normal part of the society. Now, that is not only where our whole scope ends. When we look at the entire gamut of plastic surgery, we work right from the head to toe. When we look at the head, we also look at improving the hair structure, improving the number of hair by doing hair transplants. We improve the looks of the face by doing either what you call as facelift or improving the shape of the eyes. Congenitally, sometimes you have problems in your face. Sometimes you have something called as cleft lip, cleft palate, where we operate and improve that. Make sure that you can look good and you can speak properly. We also correct your nose if there's any problem in your nose, either because of congenital deformities or because of the fact that your nose has been given a flat nose or very pointed nose or a beaked nose. We try and correct that so that you look good. The ears are also corrected if you have something called as absence of ear or known as microtia or anotia. Then we recreate ears taking your ribs and burying them under the ear and giving you a good shape there so that you start looking normal. We can also correct as far as your teeth are concerned, and fractures of your face, they can be corrected too, and they are with the help of either wires or plates so that you've got a normal look of your face. Cosmetically also, if you have protruding lips or protruding upper part of the upper lip, that can be corrected too with surgery, and that helps in giving you a normal look. Coming down, as far as the face is concerned, as far as cancer surgery is concerned, sometimes because of cancer, you lose part of your face, your mandible, your mucosa, that is your cheek inside, and that can be reconstructed so that you look normal even when you survived after the onslaught of cancer. You want to be part of the society, you can get that reconstructed again so that you look as part of the normal society. Coming down to your extremities or let's say abdomen, we do something called as, some males when they grow up they have something called as a accessory or a more developed breast in adolescence which they don't feel happy about, called as gynecomastia. We can correct that to make it look so that you can look good. We also, in females, sometimes you have very flat chest or you have very heavy breasts. That can be corrected too by putting implants or by reducing the size of the breast. When females become middle-aged, their breasts tend to sag, then we can correct them so that you have normal looking breasts too. After cancer surgery, after breast removal, after cancer surgery, if you want to have a normal breast, a normal looking breast, not a normal breast, but a normal looking breast, we can go ahead and reconstruct that breast for you so that you have almost equal breast on both sides, along with reconstruction of your nipple and areola as well. So that it gives you again confidence to be part of the society. and self-confidence in yourself that you have not lost any part of your body. As far as your tummies are concerned, sometimes you get excessive tissue or excessive fat in your body and you're not very happy with that. Also, it happens when with age slightly your tummy starts to sag. That can be corrected doing either abdominoplasty, that is removing the excess skin, or if you're not very happy doing that and if you have just a little bit of weight excess somewhere and you need a nudge, we can do something called as a liposuction to correct that. Similarly, for your breasts and your thighs, we can correct that giving you an arm lift or a breast lift, and that helps in giving you normal shape as well. Now this talks about the whole gamut of that, but then we have some congenital problems, and which can be a problem in the sense you have something called as involvement of your nerves. And you may have absence of working of your hand because something called as an Erb's palsy, that is that during delivery the child's nerves at the shoulder get stretched and the hand stops to work. Sometimes it also happens in adults that you can have road traffic accident leading to damage to your nerves emerging from your neck, and that is called as brachial plexus injury, and it requires us to do some work under microscope so that we can join those nerves, explore it, join it, or take some nerves from other places so that your hand gets some form of function and you can make it as a useful hand and not a flail limb or a paralyzed limb. And we do that also. Then coming to your hand is a very important part of your body and it requires a good function, and we can work towards even when you have congenital problems of your hand that need to be corrected. That means an excess digit, or you have joint digits, or you have bent digits, we can correct that for you. If you have absent digits, we can work on that to give you a better looking hand, a better functional hand. Because in hand, what is more important is that you should have a good function rather than a good looking hand. Apart from that, the hand has other problems, like you can have trauma leading to damage to either loss of tissue or your tendons. Tendons are guides which move your fingers. We can correct that so that you can have a normal working hand, working fingers again. Also, sometimes you get compression of nerves because of some issues. You have bent fingers known as Deptt contraction, and we can correct that. Having said all of that, of course, burns and its sequelae is also part of plastic surgery, and we manage these burns either as a primary problem or we can manage them the sequelae of burns, healing of burns leading to contracture formation, scar formation, and sometimes some ugly looking or contracting tissues anywhere in the body that can be corrected using the help of plastic surgery. We can even put in tissue expanders so that we can expand your normal skin to cover the defective or contracted skin so that you have again a normal looking life. So if you look at plastic surgery, we can help you in great ways right from tip to toe, and this is just the tip of the iceberg. You talk about it and plastic surgery can help you have a normal life and become as normal as possible as you were before injury or surgery or congenitally. We are always there. We have 3 consultants working all the time trying to help you do whatever we can for you. You're more than welcome to contact us in the hospital. Thank you.